Hello, how are you? Today I'm going to talk to you about how sore feet can indicate health problems. Our body is very wise, right? It uses signs and symptoms to show us that something isn't right. And there are 6 health problems whose signs and symptoms also relate to issues with the feet. I'm going to tell you what these signs and symptoms are. They're very different, and what these health problems are so you can pay attention. Stay with me until the end. You won't want to miss this. Before we start, I want to ask you, how old are you? Where are you from? And do you feel any pain in your feet? What is it like? Is it a constant pain? Does it come and go? Is it like a prick, a stabbing pain? Is it a cold pain, a hot pain? Tell me about this pain. I want to know. I would love to see your comment, and remember to like the video. That helps me a lot here on the channel. And if you know someone who already suffers from foot problems, share this video. Let's expand this chain of good, because that's what I want here with the channel. The first disease that can be related to foot problems, to foot pain, is peripheral neuropathy. And when we think about neuropathy, that's right, it's a disease of the nerves, peripheral nerves. This peripheral neuropathy is very common in people living with diabetes. So it's an injury to the peripheral nerves, usually caused by high, persistent, constant blood sugar over a long period of time. This hyperglycemia leads to glycation of proteins and damage to the myelin sheath, which is that fatty structure that surrounds the neurons and impairs the conduction of nerve impulses precisely in this area of our foot. So the common symptoms are numbness, tingling, a burning or electric shock sensation, and pain that gets worse at night. Yes, it can occur in up to 50% of people living with poorly controlled type 2 diabetes, so the prevalence is extremely high. So, to prevent it, what you need to do is maintain strict control of your diabetes, right? Always follow up with your doctor, supplement vitamin B12 when necessary, and exercise to maintain the sensitivity of your feet. Do you usually check your vitamin B12 levels? I have a really great video here on the channel talking about the signs and symptoms of B12 deficiency. I'll leave it for you down below in the description. The second problem may be related to circulatory issues. And these circulatory problems can come from various causes, right? High blood pressure, high cholesterol, even venous insufficiency. High blood pressure and high cholesterol damage the walls of the blood vessels, promote atherosclerosis, which are those fatty plaques, and reduce blood flow to the feet. So because of this, there's less oxygenation, less nourishment of the tissues. The person may feel pain when walking, a feeling of heaviness, swollen feet, so the feet may feel cold. There may be wounds that are slow to heal because the circulation there is compromised. And the person may also feel that sensation of heaviness in the feet, with the feet actually more swollen. Have you ever felt this in your feet? Tell me about it. Some people may even experience a change in the color of their feet, with a foot that becomes more purplish or more brownish in certain specific areas. So what do you need to do to control this problem? Control your blood pressure, control your cholesterol, always check how they're doing, take light walks, do regular exercise to keep your circulation working as well as possible, and avoid spending long periods sitting with your legs down, being sedentary, so you can encourage your circulation to work better. Another problem that can cause foot pain is rheumatoid arthritis or even osteoarthritis, right? These are inflammations and joint degeneration. Rheumatoid arthritis is an autoimmune disease. It attacks the synovial membrane of the joints and causes chronic inflammation. Osteoarthritis, on the other hand, is a natural wear and tear of the joint cartilage with loss of type 2 collagen. The symptoms are very similar. That morning stiffness, right? As if the foot feels stiffer in the morning, pain when you put weight on the foot, and deformity over the years. So, people with a family history or with autoimmune diseases may be at higher risk of developing these issues. So what can you do to try to prevent this? Muscle strengthening, inflammation control, and an anti-inflammatory diet. There's an entire playlist about anti-inflammatory eating, about how to reduce inflammation in the body, and some really great material with recipes, meal plans, and tips. I'll leave the link for it down below in the description for you. Another health problem that can cause foot pain is gout, right, which is caused by excess uric acid. Gout, specifically, this increase in uric acid in our body leads to the formation of crystals in the joints, mainly in the big toe, the first joint of the big toe, which can cause sudden and intense pain, redness, and local heat. The foot can become swollen, red, and really inflamed. It's more common in people with metabolic syndrome, hypertension, and kidney failure. I have an entire video talking about gout, the best diet for gout for uric acid. What you need to do is reduce red meat, organ meats, seafood, and alcohol, and always stay very well hydrated. If you want to know more details, you can watch my video about gout, which is very comprehensive. There's another issue that can cause foot pain, which is the loss of plantar fat, which is the fat in the foot. This can happen to many women during menopause and as they age because estrogen helps maintain the thickness of that fat pad in the feet, And with the decrease in estrogen after menopause, this protection lessens. So you end up with less cushioning and more pressure on the bones and joints. And women with osteoporosis and hormonal imbalances may feel this more intensely, experiencing stronger pain. So for them, it may be very necessary to use cushioned insoles, do strengthening exercises for the foot muscles, and wear more suitable shoes to avoid these problems as well. I have a playlist about women's health and lots of videos and tips about menopause, which I'll also leave down below in the description. Another thing that can also cause foot pain is obesity. Obesity obviously will cause a mechanical overload. There are a lot of extra pounds there. Each extra pound can increase the force exerted on the feet while walking by 4 to 6 times. So just imagine people who are 10, 20, 15, or even 60 pounds overweight. There are people who are extremely obese, who are way above their ideal weight, and who put a tremendous amount of strain on their feet and joints. In addition, obesity is linked to diabetes, hypertension, and systemic inflammation, all of which will also worsen foot health. Atherosclerosis, as I mentioned, and inflammation itself, which worsens osteoarthritis. So obesity can also cause other diseases, and it can be a multifactorial issue, associated with other factors as well. So definitely, losing weight gradually and in a balanced way will help reduce foot pain if you suffer from foot pain and if you are also overweight. I actually have an entire playlist on how to lose weight in a healthy way. I'll leave that playlist down below in the description to help you as well. And there's also some really great material, and I'll leave the link for it here as well, with lots of recipes and plenty of tips to help you in a natural and stress-free way. I'll leave the link for it for you down below. So tell me, do you suffer from foot pain? Does this pain come and go? Were you able to relate it to any of the issues I mentioned here or not? In your case, was it really an injury, some problem, or did you hurt yourself? Because of course, right, I talked about some health issues here, but obviously there are many others, and it's possible I didn't mention yours here. So remember that this video is purely informational, okay? If you know someone who would appreciate the information in this video, share it with them. Let's expand this chain of good, because that's what I want here with the channel. See you next time. Bye.